DEMOCRATIC. Everything you need to know about the Vigo Dem Party. So sit back, relax, and watch from anywhere. Get ready for a chat with the chair.
I am Joe Etling, Chair of the Vigo County Democratic Central Committee. Welcome to the award-winning Chat with the Chair. We're delighted you could join us. We're getting down to almost single digits for counting down for shopping days till Christmas. So if you haven't gotten out to get your gift for the Chat with the Chair, then you're running out of days. So make sure you're working on that. Hope everybody's having an enjoyable time with their family and friends this holiday season. Here on the chat, we're encouraging everybody to make sure you're out getting vaccinated. That's so important. And of course, don't forget about being vaccinated as well for influenza. That's so important to get your flu shot as well. I know there's, needless to say, discussion about getting your COVID vaccination. We want to encourage everybody to get that flu vaccine as well. And we've got a great guest with us this evening, so we don't want to waste any more time hearing from me. Our lovely guest here. Tell our viewers who you are.
I am Haley Newton. I'm a nurse practitioner with Ileana Internal Medicine, particularly at the South Office.
So we are delighted that you could join us. Obviously, it's wonderful that you're here, and of course, very timely, the topic, but if you wouldn't mind telling our viewers a little about your background.
Yeah, so I am a Terre Haute native. I went to Terre Haute South. Believe it or not, I did have some political background. I was student council president in middle school and class president in high school. I went to Ivy Tech Community College here in Terre Haute for my associate's degree in nursing. So I got my RN, and then I started working at Union Hospital at that time, and then I progressed on with my bachelor's at Indiana Wesleyan University, and then my master's, my nurse practitioner program through Indiana State. And then currently I am enrolled at St. Mary's of the Woods for a master's in healthcare administration.
Very nice. Of course, you have a very familiar last name politically to many of our viewers, I know. So, of course, you have politics in your blood. So,
I do.
yeah. So, needless to say, it sounds as though with your success in high school, that we might be able to encourage you down the road here to get involved. But what was it that drove you to the medical field? What was the inspiration for that?
You know, I think I was just really fortunate my whole entire life. I just kind of knew, I was going to be in nursing. I can't really say, I had this epiphany moment, but I remember even, in middle school, and I knew I wanted to be a nurse. And I think, as I got into high school and I did a internship with Dr. Sackman, who's an OBGYN here in town. I started filing for him when I was like 17. As I got into nursing school, he let me do a little bit more in the clinic, and so he really taught me quite a bit. So I was just kind of fortunate that I've always known that I wanted to do nursing.
So, proud graduate, Terre Haute South.
Mm-hmm.
What was it?
Braves.
There we go.
Mm-hmm.
We like the mascots here in the chat. Of course, you had a lot of other activities you were involved in high school.
Yes. So I was actually a wrestler, varsity wrestler my junior and senior year. I was a team captain. I also played softball. Let's see, what else did I do in high school? I did track one year. Involved with just lots of extra curricular activities. 4-H, I was a 10-year 4-H member, and I hope that my daughter continues on with being involved with the community as well.
So of course we do our research here on the chat, so we were
fact check time.
we were well aware of your acumen on the wrestling mat, and of course. Rumor has it that you used to work your father over pretty well.
I still can. That's really why he had to have his knee surgery.
I can believe it.
And I joke with, some of the athletes at South now, if they come in, for a physical or whatever, I'll ask them, what sports do you play? And then they'll, if they say anything about football or wrestling, I'll say, Coach Newton, you tell him that you hear that his sister can still beat him. And so then Ian, he gets all riled up. I can't believe, one of the boys said that to me in front of everybody. And I'm like, well, It's true. I'll take you to a match.
Well, I think your brother, Ian, who of course was an accomplished wrestler and football player and is doing a tremendous job coaching at the moment down with the Braves, he also, I think, was captain of the wrestling team.
Mm-hmm.
So, but you beat him to that.
I did. It's the first.
So very impressive. So again, that is a unique path that you've taken. We want to make sure we highlighted that, and of course, we also want to make sure we took a couple extra shots at your father as well.
Yep. Oh,
That-
of course.
that's
Always.
important.
That's our family's best pastime, and we can
Absolutely.
he can always be the joke.
But he's a good sport.
He
though.
is a very good sport about it.
And I know that he really enjoyed that time, and particularly when you were wrestling. And of course, I know your softball career was very distinguished as well. But I know that he had some anxious moments at various times during some of your matches.
Oh yeah. I've always kind of been the how do I word this like beautiful? I've always kind of been the child to kind of push the limits, I guess, but in a good way. And so my parents were actually bringing my brother out to college, and we briefly kind of talked about it, and they're like, no, you're not going to wrestle. It's that's just for the boys. So I'm like, I've always kind of been like, okay, if a guy can do it, I can do it just as good. I tried to play football in middle school, and the coaches, they'd always just say, nope, you can't do it, you're a girl. So it's not like how it is today where, girls are more involved. But so I called them, one day after school, and they asked, how was your day? And I was like, oh, I went to wrestling conditioning. What? And that was, before really cell phones. So we were talking, and so I was like, well, you guys were out of town. And actually, I fact checked it, and I'm like, there's less injuries in wrestling than what there is in cheerleading or in gymnastics.
Absolutely.
And the rest is kind of history.
Well, of course, we've kidded about your dad. Of course, we all know who's running the show, your mom.
Oh, of course.
Right? But
everybody knows that April's in charge.
Yes. Of course, so both your mother and father, I know, have encouraged all of your family, and of course, and your sister, that you can do anything that the boys can do. Isn't that right?
Yes, absolutely. And that started with my grandma, my mom's mother. She's passed away, but she was always very like women power, like women can do anything, and so we've just kind of carried that on.
So of course you pursued this pathway as an RN, and then you've obviously advanced yourself with your education and your training, and let's talk about what you're doing right now then.
Yeah, so right now I do internal medicine, so it's essentially primary care for 16 and older. Most of my clientele are the 65 and older range, but I do get, some 16, 17-year-olds. Most of the other providers in the practice, we really prefer 18 and older, but we'll see them at 16. Before I worked in the office setting, so about 4 years ago, I worked in the ER for about a year as a nurse practitioner, and then I guess kind of moving backwards, I worked in the ER as a nurse for several years, cardiac cath lab. I started out on the orthopedic floor. I also have experience in like a family practice, just office setting, and then my first job, I guess, was the OBGYN office.
So for our viewers that may not know, talk about, with regard to your specific position now, what you can't do in that capacity.
Yeah, so I have a wonderful collaborating physician, Dr. Reddy, or Venkat Reddy, who's also Judge Reddy's husband, and we all know that she runs the show in that family too. So we see this theme, the girls are really, in charge. But no, he's amazing to work with. Every practice is a little bit different. Nurse practitioners, physician assistants, it's actually one of the fastest growing occupations in the United States because of our aging population and, just how sick our population is. So it just varies state to state. In Indiana, we have to have a collaborating physician. So Dr. Reddy is mine. I have to send him 5% of my charts for him just to review over, but I can send in any medications, I can treat, diagnose, make referrals. He kind of gives me, the reins on a lot of things because I kind of practice that I'm not going to, do anything obviously to harm anybody, but I know what I know and I know what I don't know. And if I don't know an answer, I know where to go to. So if I don't know an answer to something, I can, tell my patient, let me go check with him, or, let me get back to you, let me do some more research about it. But yeah, so I can pretty much do, I'm not going to say that I'm equivalent to a doctor because obviously my training is not, but I can send in medications for patients. I can order infusions outpatient. I can order physical therapy, occupational therapy, speech therapy, do sutures or, smaller biopsies. That type of thing.
So talk to our viewers about the training and educational requirements for that.
Yeah, so for my nurse practitioner, so I have a master's degree. A couple years ago they were trying to push more towards a doctorate degree, but right now it's just master prepared. And then I have a nursing background. So physician assistants, that's another big question that people will say, what's the difference between you and a physician assistant? Well, my background is nursing, where their background might be biology or chemistry, pre-med. They could even have art, any type of background, where I started out as a nurse first. And so our training is a little bit different. During the program, you have to complete so many hours training under either a physician assistant, or another nurse practitioner. So really, I got a kind of mix because I did some of my clinicals with a nurse practitioner. I did, a couple with a couple different physicians, so just the training, is different person to person. But yeah.
How have you found that background as a nurse to assist you in what you're doing now?
I found it very beneficial, mainly because now I guess at this age of my life, like for the age that I am now, essentially half my life I've worked in the medical field. So I feel like, my base with Dr. Sackman, he was the one that taught me how to draw blood and how to do, certain procedures. And so just every year that I was either in school or working as a nurse, I was just able to build, on those blocks. So even now in my practice, with my ER background, I like to do sutures, I like to do, biopsies and, just different things. But then I also use some of my cath lab background where, if anything with the heart, comes up, I kind of got a little bit of a base to say, okay, we need to order this test or that test, send you, to whatever physician for referral.
Now we don't want to destroy any confidences here or have you breach anything that would apply here, but it's got to be that your most difficult patient of all time has got to be your dad.
Oh my goodness! So yeah, he has been like the most needy. I'm not breaking HIPAA because this was at the dinner table last night. He was complaining about, I don't know, whatever he needed done. And, they were supposed to send you a prior authorization. And he walked in the other room and I was like, I'm eating dinner. I'm not clocked in. That is not my job to, complete that form. I think
you're on call 24/7 for him,
and then he yells from the other room, do you want to get a bad review? And I said, do you want to get fired as a patient?
Of course, you were with us when we were talking earlier, and the chat with the chair was promoting vaccinations, both for COVID and for the flu. So I'm assuming that that's something that you might find to be good advice for our viewers.
Yeah, absolutely. So my family, we are very pro-vaccine. My 3.5-year-old daughter has a nurse practitioner kit that she carries around the house and will administer flu shots. She won't give you a Band-Aid half the time, but she is pretty good at it. She'll get my dad multiple times a day. No, and all joking aside, she does. She goes and gets her flu shot every year. We got the postcard in the mail as a reminder earlier this fall, and so she would ask, is it time for my flu shot? Is it time for my flu shot? And I have patients ask me daily about, COVID vaccines, or, we also advise patients, on shingles vaccines, pneumonia vaccines, and it is really important. We have eliminated so many diseases off the earth, or out of our community, I guess I should say, because of vaccines. So it is really important. My patients will ask me, well, what about your daughter? Would you do it? Yes, when my daughter is of age, she will get her COVID vaccine, because I see the effects of post-COVID, the long hauler symptoms multiple times a day. I have patients, in our office, and even patients. I think one big misconception right now is, well, I already had COVID last year. I had COVID, earlier this year. Why would I need a vaccine? We're still learning quite a bit about COVID, but one thing that we do know is after that 90 days, you can get reinfected. So a lot of people will think, oh, I have immunity to it, and after that 90 days, your immunity level goes down significantly. I have patients in my clinic that have been infected, 2 and even 3 times with COVID, because out of that 90-day period, then they can get reinfected, and people just don't realize that because of the misinformation that they have.
Well, if we can lean on you professionally, then those of our viewers who have had the vaccination and the booster perhaps, what would be the time frame to get the flu vaccine then?
So that's a good question, because a lot of the pharmacists,
Award-winning.
it is award-winning. A lot of pharmacists will say, I think there may even be, some commercials on TV, saying like you can get them at the same time. What we tell our patients is to wait 2 weeks. 2 weeks between your COVID vaccine and anything. You can do your pneumonia vaccine and your shingles vaccine at the same time. You can do your flu vaccine and your shingles at the same time. But do not do anything with the COVID vaccine, 2 weeks. So I got my flu shot a couple weeks ago, and so now I'm due for my booster for my COVID. So I'll be getting that before Christmas time.
Well, here on the chat, we like to give the facts, just the facts. We don't, no
The
misinformation
whole
on
truth
the
and
chat.
nothing but the truth.
Absolutely. So of course, this has been, I'm sure, at your profession, such a trying time with the last 2 years. So talk about the impact in your field, and then what you're seeing, particularly in Vigo County with COVID.
Yeah, so exhaustion. I know, the girls and boys on the floor in the ER. I'm still friends with quite a few of them in the ER. I've got patients, that are working there, nurses, x-ray techs. It's just exhausting for everybody. It's just a vicious cycle that we just have to break as a community. And, there's so much misinformation out there. It's really unfortunate where, if this was 20, 30 years ago, well, one, we wouldn't have Chat with the Chair because we wouldn't have Facebook Live. But all joking aside, I think that it's just very easy to spread misinformation. You can also get, lots of good information with our social media platforms. But it's just unfortunate because you have to kind of take it with a grain of salt, because there's so many people, that can get out there and say, well, my mom had this reaction, or my dad had, or my second cousin, third time removed, had whatever reaction to the COVID vaccine. And I follow quite a few like fertility specialists, because that's another question I get from my patients. Well, what about, if I'm of childbearing age, or what about my children and their fertility, down the road with the COVID vaccine? All of the fertility specialists that I follow in New York, California, Houston, all the big cities, get your COVID vaccine, because the long hauler symptoms that patients have, the inflammation in their body, can cause more fertility issues down the road than what the vaccine has been.
You mentioned the long hauler a couple times. Tell our viewers what that is.
Yeah, so long hauler are those patients that are in it for the long haul. So you've been infected with COVID, and now, 2, 3, 6, 9 months later, you're still having symptoms. So whether it be severe shortness of breath, fatigue, headaches, there's some, even mental health issues that are going on with some of those patients. Sometimes they'll feel fine most days, and then other days they feel really bad. Or it could be just a continuous cycle of day in and day out of these symptoms.
And I'm assuming treatment is still evolving for those patients.
Correct. Because of the variants, what we're still learning about COVID, we're still trying to figure out what's the best course of treatment for them. So a lot of it is we're trying to figure it out. We will try certain things, like if it's shortness of breath, we've got a really good pulmonary rehab clinic at the hospitals. We've got different exercises that you can do to help strengthen your lung capacity or your endurance, whatever it may be, kind of just depending on whatever symptoms you have.
So with regard to the other vaccinations that are required, particularly for school-age children going to school, are you finding that people are questioning those vaccinations?
So because I only do 16 and older, there's not too many, that 16, 17, 18-year-old that people will question. I know that from a pediatric standpoint, from when I did my clinicals with Danielle DeGroat, who's a nurse practitioner, they require vaccinations for all children in the UAP pediatric clinic. They will do, or they used to be able to do kind of a delayed schedule because some people, don't believe in doing them all at once. But my daughter, she is witty as can be, and she helps, pick on my dad all the time too. Nice. You got to start them from a young age.
Yeah.
But she, we did the normal schedule, and it isn't for, everybody. It is patient to patient and family to family, but that's a good conversation to have with your practitioner on, what vaccines are needed and why. I know that there is a big delay in a lot of children getting proper preventative care because of COVID. They haven't, gone to their well child checks. Even adults in our practice, particularly, we're working on our Medicare population right now and making sure people are up to date with all of their preventative care because there's been such a lapse over the last 2 years.
Of course, the impact of COVID on those people's families who have lost loved ones because of it, and those who have suffered, and as you indicate, continue to suffer, who have been infected with COVID. It's been devastating and heartbreaking. But you raised an interesting issue with regard to those frontline workers, those people that are in the hospitals, those people that are in the emergency rooms having to deal with patients on a daily basis. What's the impact on those individuals with their mental health, their physical health, and even their desire to continue with that profession?
Yeah, so that's a very good point. I mean, right now, nursing burnout, any type of healthcare burnout is huge. Because they are so exhausted from everything. A lot of people are quitting and they're going to travel nursing because they can make a significant amount more, and they think, well, I could go to a different facility and make, more money doing the exact same thing. And that's a whole nother conversation for another day, because there's so many professions that are completely underpaid for the amount of work that you do. Where other professions, they may get paid a lot more for what they do, but that's neither here nor there. That's a different conversation for a different day. But if you hear that there's a nursing shortage, there's not a nursing shortage. It's that pay compensation that I think a lot of healthcare workers are, wanting, because they realize, that they can go other places and make more money for the same type of work. But it is frustrating, when patients come in to the ER, wanting treatment. They have COVID, they're having this severe, shortness of breath, they feel like they're suffocating, they're having nausea or vomiting or, whatever symptoms it may be. And then they want everything done, where this is totally preventable, where if they, going back to the vaccine, if they were vaccinated, so much of this could be prevented. And there is the argument of, it wasn't FDA approved for so long. Well, you're going to do all these other things that aren't FDA approved quite yet, when you want the treatment. So it's just really frustrating because it's so preventable to get it. And it isn't 100%, but the idea is if you get vaccinated, whether it be COVID, whether it be the shingles vaccine, whether it be, your symptoms are so much less by getting the vaccine compared to if you didn't.
So what do you think that you as a healthcare professional, and then our viewers that aren't, what could they do to help encourage people to get vaccinated?
Definitely guiding them to the right information. And I know that people are really frustrated as far as, what the FDA says, or, what certain news stations will say, because you turn the channel and it says one thing or another. But really, just be smart, be safe. Anything that you can do for prevention, why not take it? I know, we're on topic of COVID vaccines, but, even the HPV vaccine, a lot of parents are really hesitant about having their kids get the HPV vaccine or Gardasil injection, and really what you're doing is you're preventing against cancer. So why not do it? We know that it works. It's effective. So just the more prevention that you can encourage your family members, your friends, even doing it yourself. I know on our badges at work we have, a little pin that says, I'm, vaccinated for COVID-19. And I have that conversation with patients every day. And I use myself as an example. My 94, almost 95-year-old grandma is fully vaccinated. I'm vaccinated.
Give her a shout out.
Yep, there you go, Belma. She'll be excited. My grandpa, before he passed away, he was on hospice, and he still said, I still want to get vaccinated for this. I don't want that to be, the cause of my death. And vaccines do have side effects. Me personally, I felt like I got hit by a Mack truck with my first one. My second one, I did break out in hives. But also my hives for a week is a lot better than COVID for 2 weeks, or COVID with, for several lingering symptoms with the long hauler stuff for several months. So, just with my next one, we'll just pre-medicate with, some Benadryl. I'll have somebody prescribe me some steroids. So I would rather, be a little bit more proactive and run that risk of having, a little bit of a side effect versus having, to be admitted to the hospital.
Well, we want to be positive here at the holiday season, but we also want to make sure that we're giving good information and reliable information. So from the standpoint of the impact of COVID that you're seeing right now with people coming into your office as well as those people in their respective hospitals, what is the state of Vigo County, you think, with COVID right now?
I think we're going to see an uptick over the next couple weeks, especially with Thanksgiving. Most importantly, if you have a fever, stay home. If you have, even if you think, okay, I get bronchitis every year, I get a sinus infection every year, I get, whatever every year, it's just allergies, it's because I turn the heat up. The tests are so easily available. You can go to Walgreens, CVS, you can call your primary care doctor, you can go to convenient care, you can go anywhere and get a test nowadays. Why not just test yourself and see, okay, if you are positive, stay home. Yeah, it's unfortunate, but at the same time, you're preventing, your loved ones from getting sick. Going into it, I thought, okay, I'm not going to be the first person on the first day to get the vaccine. And when they had it available for healthcare providers, I got it on the first day. But I thought of myself, not necessarily like, what if I get COVID? What if I get COVID and I pass it to my grandma? Or I get COVID and I pass it on to my patient that has cancer? Or I get it and I pass it on, to whoever. You have to think to be a little bit more selfless, I guess, this time of year, and what better way of doing it by not spreading COVID. But really think about the people that you come in contact with, even children, if they get it, they're pretty resilient, they're going to be able to bounce back pretty quickly, but they bring it home to grandma, grandpa, brother or sister that has a lot of health issues. They might not be as fortunate.
Your grandparents and your parents have, of course, taught you well, but that's, of course, what probably it all comes down to, what you articulated there, that is to be selfless. Mm-hmm. And that is as good a reason as any to get the vaccination, is to be selfless, and so that's what you've done here. Now, we are also, as you indicate, coming out of one holiday season and approaching another. So from your perspective as a professional, any advice for people as they are getting together for Christmas and various office parties or home parties, going to events, any advice for them with regard to how they should approach things given what's going on in the medical field with COVID?
I mean, it's kind of hard. Every person and, situation is a little bit different, but, if you don't feel good, try to avoid those. Or, even if you come in contact with somebody, okay, I was with my mom at Thanksgiving, she tested positive, I feel fine, so I'm just going to keep going to work. Well, that's the problem where everything keeps spreading. Not my mom. Sorry, April. Don't ground me. I will get in trouble for saying that. But if you have a family member, that tested positive, you have been around them within the last week or so, just be mindful of that, because you don't want that to spread. If you feel good or you don't feel good, stay home. Wash your hands, socially distance, and now we can kind of be a little bit more lenient, I guess, is what we were last year, but still kind of be mindful of that going into the holiday season.
But we're still promoting to people to wash their hands and to...
Why is it such a novel idea to wash your hands? I don't know. When this came out, I'm like, okay, do people not wash their hands? Do people not use Clorox? I use, maybe that's just because I'm been a healthcare worker most of my life, but wash your hands.
Who knew? So, of course, we couldn't get you out of the chat without having to move into the question about whether politics is in your future, consider it's in your blood or not.
Oh, goodness.
I mean, with that medical background and all the education you have, and as your great people skills, has that ever crossed your mind about?
I gotta have, people gotta wonder. That's what it is.
Is that it?
No, no, I kind of thought in high school, I may be done with politics, but I think my family, my grandpa, my Grandpa Newton, my Uncle John, I mean, all of us have been in politics for so long. I don't think that I will ever be able to deny that I'm a Democrat through and through. But I'm not sure. It may be kind of refreshing. I know there's a lot of things with healthcare right now. I'm involved with CAPNY, which is the Coalition of Advanced Practice Nurse Practitioners or Advanced Practice Nurses in Indiana. So that's more on a legislative level. There's a few other things that I've been kind of working on, some other committees that are more legislative type things, and so I think maybe it would be a good, gateway to spread some more health promotion.
So it sounds like it might be a possibility. Of course, in that office of yours, Dr. Reddy, he's quite the campaigner himself.
Oh yeah, you get Dr. Reddy, and it's pretty much like God is like saying it to his patients. If he tells them something, they will worship the ground he walks on. So
he does a great job, and it's great to see him out and about in the campaigning as well. So any thoughts or advice for our viewers as they, again, approach Christmas?
Nope, I just hope that everybody has a Merry Christmas and Happy New Year and stay safe and healthy.
We are so delighted you joined us. You got some great information and great insight for people. Any last thoughts for people medically or otherwise?
Just get in to see your primary care provider. If, they call you, I know there's a lot of nurses right now that are wellness coordinators. If they call you and say, your provider wants you to come in for a wellness visit, don't turn them down. It's not spam. We really do want to get you in. We want to make sure that all of your preventative stuff is up to date to prevent any further, health care problems. A lot of patients will think, well, I'm healthy. I don't need to do that. It's better to be proactive than reactive with your health care.
And it's great that you're now out at St. Mary of the Woods.
Yep.
A lot of great things going on out there.
Yeah, it's changed a lot since the last time I was out there. So it's an exciting time for sure.
Absolutely. Well, we are so glad you came in here and joined us, and you're doing so many wonderful things. And,
Thank you.
And good luck taking care of your father. You've got your hands full there, but we hope you and all your family have a wonderful Christmas season here. And we appreciate everybody tuning in and enjoying the chat with the chair, and hopefully found this very informative. I know that we did. And again, we're going to encourage you all to get vaccinated, and remember to like us on Facebook and to share us out there in the digital world. And of course, remember, if you've had your COVID vaccination, we want you to wait 2 weeks.
2 weeks, yeah.
2 weeks, so you've made a note to yourself, 2 weeks, mark it on the calendar, 2 weeks, and before you have that flu vaccine. But make sure you do that as well. And again, until our nenext chat with the chair, I'm Joe Etling. Thank you for joining us. Be safe.
DEMOCRATIC. Everything you need to know about the Vigo Dem Party. So sit back, relax, and watch